Morning. My name is Maggie O'Loughlin, and I am here representing the school nurses and specifically school nurse program in regards to the 2011 National Scorecard data under Healthy Lives and children who have missed school greater than 11 days due to a health injury or a health illness. Across the board, the nation is judged or measured via a questionnaire and survey that is done on telecom systems. The background behind this is that the Agency for Healthcare Research and Quality has been charged to make healthcare safer, higher in quality, and also more accessible, equitable, and affordable for the nation. The 2011 scorecard did not actually meet that, and in fact has come down from 2008 and 2006. Their benchmark has been set, and we are actually below benchmark on many areas that have been shown. It's broken up into 5 areas of healthy lives, quality, access to care, efficiency of care, and then, of course, equity of care. Our general score as a nation has gone down from 67 in 2006 to 64 in 2011. This is due to multiple factors, most of it being access to care and affordability of care and insurance. The specific area that I'm going to be talking about falls underneath the category of healthy lives and has to do with access of children ages 6 to 18 who are missing greater than 11 days of school due to health injury or health illness. This area has actually shown a slight deterioration. Overall, the 2011 status has shown that the whole report and survey has come down and had delineations, though there are a few areas that have shown improvement. The specific area, like I said, that I would be discussing is healthy lives and school-age children. As a school nurse, I was required to track the annual basis number of days missed by a student and if they had a potential diagnosis, long-term diagnosis, or any kind of health issue that would have led to those greater than 11 days missed. This also was sent up to the state, and my belief is from the state, it was then sent up to a national database. What's shown here in this report is that the 2011 report came out with the fact that we went from that our average was a 5.8, a benchmark was 3.8, and that we were given an overall score of 66. What it's showing is that we have greater than 5.8% of our students are missing 11 days of school due to some sort of illness or injury, when we should have only 3.8% based on a comparison of other nations. What's being done to improve this issue? For the specific indicator of greater than 11 days school days missed, the National Association of School Nurses has added this data to their training for all new nurses and new members of the association. And now they track this data statewide so that each state is able to see where they fall amongst other states. The data and also the information is put into a toolkit so that school nurses are aware of what they need to be looking for, what they can do to improve those number of days, and also to make sure that they're working with the parents and the students to find out what's going on, how their health history is, and how their health status is so that they can make sure that they have the care that they need and that they're in the classroom. My belief is that also this can be used to ensure that they have the one-to-one aid or the health delegation aid that may be needed at their side to ensure that they're in the classroom or if the classroom has been brought to them at the home. You can see on the slide below that the National Association of School Nurses is now tracking this data and makes it part of their toolkit along with their state data. What has not worked is that we can see that the national survey has been able to change affordable insurance or access to care. Neither one of those two things has been able to be improved with this survey or with the healthcare policies that are in place presently. Care has become too expensive. Premiums for insurance have risen much faster than the income that most of the United States has. And due to this, preventative care is not really utilized as preventative, but more as urgent care, thus leading to more hospitalizations and possibly even rehospitalizations. The quality measured for this issue was done via a telephone questionnaire and survey to parents of school-age children. They were asked multiple questions, and the CDC actually provided the specific questions that were asked to include diagnosis of specific conditions, cost of medical care that might have caused financial burden, did they have any home visitations by healthcare, and of course, what is their insurance status at the time that they were doing this telecon. The health policy improved, and how can healthcare be improved, and what do I need from you today as a Congress? It is that I need for you to create some sort of policy and put in place a national and state level that ensures the appropriate staff to student ratio when there is an IEP that shows healthcare needs. I'm hoping that this will allow the right staffing with the right costing in this districts at the state level, and ensure that they're able to have the right staffing so the student can be in the classroom. What I need from you as a Congress is support and funding. That funding needs to be funneled down to the state level, and it needs to be utilized appropriately at the state and district level so that the superintendents can utilize and give the money to the schools where it's most needed. I appreciate your support with this, and I look forward to your follow-up.